UC San Diego researchers surveyed more than 39,000 smokers who tried to quit in the last year and compared the nicotine replacement drug Chantix to other replacement therapies like the nicotine patch, gum, inhaler, and other prescription medications. And they found Chantix doesn't translate into more smokers breaking the habit. Joining me with the implications are my guest, epidemiologist Wael Al-Dalemi, smoking researcher at UC San Diego School of Medicine, and Jody McEdward, a certified tobacco treatment specialist at Sharp Reese Steely. And Jody, how is Chantix different than other nicotine replacement treatments?
Well, unlike nicotine replacement therapies such as the patch or lozenges, the gum, or even the nasal spray, where they put a little bit of nicotine in the brain to relieve cravings and think clearly, what Chantix does is basically keep the nicotinic receptors from breaking down and needing more nicotine, or dopamine rather. So essentially they're satisfied and there's no craving.
So it works on the craving side. And Wael, now we know that UCSD researchers found that it had no significant impact, as they put it, on adults who tried to quit smoking. Is there any ideas why this type of process didn't work as well?
Well, I mean, it's well known that there is no one magic bullet that will help in treatment. It's a multiple of ways. And so this is proving to the evidence that we have found that 70% of people actually quit on their own without any treatment.
And Judy, speaking of quitting, we know a bunch of people, I'm sure all of us know someone who's tried to quit over and over again and hasn't been successful, and others quit cold turkey. They've been smoking for years and they quit cold turkey. What plays into whether a smoker is successful at quitting?
Well, it starts first with the desire to quit. Always. That's so important. You have to want to make the change. But it's also starting to pay attention to the very subtle but automatic behaviors where smoking or any tobacco use bleeds into our lives. So their plan has to not just be about medication. That's a bridge. It's to help get over cravings. You have to look at your social environment, and you have to look at the powerful memories and the emotional relationship that you have with this drug that's helping you deal with your life.
Now, Wael, you touched on this. So 70%, you said, this means that 70% of people may do better quitting on their own. How else can this research help others who are trying to quit?
Well, I mean, I think it kind of brings into light that there is no one single treatment that is going to resolve this major epidemic of smoking, and that this is not as the industry and pharmaceuticals that produces posed it that it would be, that it was going to solve or make the quitting. It does help, but it's not much different from the others.
Now, a USC study, actually, I'm sure you guys are aware of, suggested that kids who use e-cigarettes, young kids, are more likely to start using tobacco products than their non-vaping peers. Jody, but for adults, are e-cigarettes a good tool for quitting?
There's a lot of anecdotal evidence when you talk to people that they say it helped them quit. But what we know in working in our programs at Sharp Reese Steely is it doesn't help them stay quit. There's a repetitive hand-to-mouth motion that on an unconscious level is the solution to the problem, whether it's a vaporizer or whether it's actually a cigarette.
Yeah, and Wael, you actually studied this, so can you add to that?
Yeah, so our study that was published in American Journal of Public Health just recently found that smokers who ever use these e-cigarettes are significantly less likely to be quit on the long term after 1 year. So that was really a message that it is not maybe what it's supposed to do.
A long-term solution.
Yeah.
Well, California lawmakers are moving toward increasing cigarette tax again. Is cost a motivator for quitting, or are there other ways to do that?
Absolutely. I mean, there is a very close relation. This is worldwide, WHO and even California. With the increasing of the tax, there's decreasing of consumption and more quitting. And unfortunately, there hasn't been an increase in the tax in California for some time. So that's why we have a plateau of prevalence of smoking based on our data.
What other things can help? I'm thinking of outside sources, like does banning smoking in public areas?
Yeah, absolutely. Yes. When you create an environment where you're not using that particular product, you set up a rule inside your head that this is where I don't do this. And the more that happens, the more you start to say, I don't do this. And use drops. And so it is taking on another tool that will help you have that same sense of well-being.
All right. Well, Jody McEdward and Wael Al-Dalemi, thank you so much.
It's our pleasure.
Thank you.